Hello, dear students. I am Dr. Anita Kahar, and we will be learning about the various dental cements. So, what are dental cements? Dental cements are ones which hardens on placing in the tooth cavity. They are mostly non-metallic, organic, or inorganic substances, and they are supplied in different forms like powder, liquid system, paste form, and the solution. They are having a variety of applications from to be used as a liner, base, or till the restoration, temporary or permanent restoration of the tooth cavity. There are various ways of classifying the dental cements, amongst which one of is according to the acid-base reaction type. So we will be learning about all the cements which comes under this category. So we'll first talk about zinc oxide ethanol cement. Now, before moving to the zinc oxide ethanol cement, I just wanted to tell you about the cements which are coming under the acid-base reaction type of the cement. Now, here to remember and to understand, easy to understand the different cements which comes under acid-base reaction cement are that is one powder and three liquid. That first you should remember that is a major component of the powder and the liquid. So if you add a zinc oxide with a eugenol liquid, so you will get a zinc oxide eugenol cement. If you add a zinc oxide powder with a polyacrylic acid, you will be getting a zinc polycarboxylate cement. And if you add a zinc oxide powder with a phosphoric acid, you will get a zinc phosphate cement. Same way, when there will be a powder of fluoride containing aluminum silicate glass, then if you add um, liquid polyacrylic acid with this powder, you will get a glass ionomer cement, and with the phosphoric acid, you will get a silicate type of the cement. So this is a very important and easy tree diagram you can say, so that you can remember total five cements composition by looking at a glance. So coming to the zinc oxide regional cement. So here you should know all about the zinc oxidized cement. These many points you should know at the end of the lecture. Now let us coming to the introduction of the zinc oxidized cement. So according to the reaction, as we said, it is acid-base reaction type of the cement. It is a non-tooth colored cement. It is adhering to the tooth mechanically. It is not giving you chemical adhesion, and the pH of this cement is neutral. The ADS specification number of the cement is 30. So according to the ADS specification number 30, zinc oxide regional cement is classified into four types that you should know this, very important. Type 1 is a temporary cementation. Type 2 is a permanent cementation. Type 3 is temporary restoration, but type 4 is not permanent restoration. Okay. So this cement is not used for a permanent restoration. So please remind the type 4 is a cavity lining type of the cement. Now, how is the supply of the mode of availability? It is available in a powder and liquid system. It is also available in a paste form. Two pastes are available that you will have to mix while using it. Now, let us come to the composition of the powder. The composition of the powder is main ingredient is the zinc oxide, which is the principal reactor. Then white rosin is there, which reduces the brittleness, increases the working time, improves the strength. The accelerators added are zinc acetate and the calcium fluoride, which improves the strength. Zinc stearate acts as a plasticizer. Alcohol and glacial acetic acid act as a to accelerate the setting reaction. Water is added to initiate the setting reaction. Magnesium oxide reacts with the ethanol similar to the zinc oxide, and silica in traces, which act as a filler. In the component of the liquid, the major ingredient is the purified ethanol or oil of clove. Oil of clove is nothing but a less potency of the ethanol, that is about 70 to 85%, which is the primary reactive ingredient. It is also contains olive oil or cottonseed oil, which acts as a plasticizer, and it also masks the taste of ethanol. If you taste the taste of ethanol, it is very strong. It is very irritant, so it masks the taste of that ethanol, and it also controls the viscosity. Acetic acid acts as an accelerator. Now let us come to the setting reaction. Now setting reaction is very similar to the zinc oxide ethanol impression paste, as we have seen. You must have learned through the impression materials. So yes, it is acid-base reaction type of the cement. Now the powder is it is a basic, it is alkaline in nature, and the liquid is a acid. Now, if you see the reaction, setting reaction, the zinc oxide doesn't react with the eugenol directly. Okay, it needs a presence of water or acetic acid where it converts into the zinc hydroxide. And then this zinc hydroxide combines with the acid eugenol, which gives you the chelation product that is known as a zinc eugenolate and water as a byproduct. So if you see, water is needed to initiate the reaction and water is also a byproduct. That means uh, water is very important for the zinc oxide eugenol cement reaction, and this reaction is known as the autocatalytic reaction, as water is the initiation required in the initiation also, and it is a byproduct also, and the same byproduct is used to initiate the second reaction. So this is a autocatalytic reaction or a chelation type of the reaction which comes in the MCQ or it is asked in the Viva. Now, if you see the microstructure of the set cement, it is very simple and you should draw whenever the setting reaction is asked. So you can see whenever the microstructure is asked or you will have to write it into the core and the matrix. The core means the unreacted powder particles of zinc oxide, and the matrix is all the background that you can see in the image, that is the orange background, which is the product that we assume, that is a zinc eugenolate, that is a chelation product, and this is the background of the set cement. Now, what are the factors that affect the setting time? Whenever you write the factors affecting the setting time for any material, you should write it under the control of manufacturer and under the control of the operator, that is under the control of the dentist. Now, under the control of manufacturer, it is a sintering temperature. So, the sintering temperature here, the sintering of the powder is done at 300 degrees Celsius for longer period of a time. It will decrease the setting time. The smaller particle size decreases the setting time. Accelerator like calcium chloride or glacial acetic acid, it decreases the setting time. Now, what are the factors which are under the control of operator? So, one that is in our hand is the cleanliness of the glass slab, then the powder liquid ratio. If the powder liquid ratio is high, it causes decrease in the setting time. Lower powder liquid ratio cause increase in the setting time by by changing the temperature of the glass slab. Means if you cool down the glass slab temperature, it will increase the setting time, and if you warm the glass slab, it will decrease the setting time. Now, what will happen if you do the moisture contamination? It happens that is, if there is a moisture contamination, it will decrease the setting time, and same way in the glycerin, it will again act as an accelerator and it will decrease the setting time. So, this is all are the factors that affect the setting time. Now, coming to the properties of the zinc oxide eugenol cement. The first property is the obtundent effect. Now, what is by obtundent effect? The zinc oxide eugenol, when it is given in the deep cavity as a base, so what will happen? This eugenol constantly and slowly it releases through the deep cavities. From the dentin, it goes towards the pulp, and it acts as and it is having a good antimicrobial property, and it gives soothing effect to the pulp. Also, when it goes through the dental tubules and reach the pulp, it gives anti-inflammatory effect, and so it is very nicely used in the reversible pulpitis type of the condition of the pulp. It also reduces the post-operative sensitivity of the tooth also. The eugenol is cytotoxic. That's why if the eugenol and it causes the toxic cell reaction, so direct contact of the eugenol with the soft tissue should be avoided because it is quite irritant. Then the eugenol is having a bacteriostatic property. The pH of this cement is neutral. It is very pulp friendly if it is compared with the other cements like zinc polycarboxylate, zinc phosphate, and the glass enamel cement. Now, the consistency according to the ADS specification number 30, the consistency should be 30 by standard testing method to give you the good effect. And the film thickness should be 25 microns, less than 25 microns for the type 1 and type 2. And the solubility and disintegration, if it is compared to the another cement, it is high. The mechanical properties, the compressive strength is less as compared to the other cements like 40 MPa, and tensile strength is again less, 0.3 to 6 MPa. The modulus of elasticity is 220 to 5400 MPa. Now here if the strength is less as Although we are using it as a temporary cementation or a temporary restorative material, so it is good because if we are using it for a temporary purpose, it should be removed easily. So, for a temporary purpose, this strength is sufficient. Now, thermal properties, it is low in thermal conductivity, but to give this thermal conductivity effect, it should have thickness should be more than 2 millimeters. The coefficient of thermal expansion is high, that is 35 ppm per degree Celsius. Adhesion, it adheres the tooth not chemically but by the mechanically. You will have to prepare the cavity designing like that. The dimensional changes is negligible. That's why it gives you a good marginal seal. Yeah, it is non-fluoride containing because it doesn't contain fluoride in the composition. Now, how the manipulation is done? The instruments required for manipulation is a rectangular glass slab and the stainless steel cement spatula. The powder liquid ratio is 3 is to 1 or 4 is to 1. The mixing is done in a two bulk increment if you see in the image, and it is in a circular motion. You can see the powder is taken in bulk and it is divided into two increments, and the liquid is dispensed, and the first increment is first mix and then the second increment. According to the you are using it for a luting purpose or the restorative purpose, you will have to maintain the consistency of the mix. It should be mixed in a circular motion. The setting time is 4 to 10 minutes. Then what are the uses? It is used for a temporary restoration, temporary cementation, cavity liner, and low strain cavity base. And it is also used for the root canal filling of the deciduous teeth. As the deciduous teeth, the roots are resolved. So you cannot use gutta percha points as they are, the gutta percha points are non-resolvable. So you will have to use for a deciduous teeth root canal filling material is the zinc oxide eugenol. So this is the image that how you can condense the in a base consistency. Now, what are the contraindications of this cement? It cannot be used under composite restoration because it prevents the curing of the composite, and also it affects the bonding of the composite with the tooth, or the bonding agents with the tooth. There is a it affects the micromechanical bonding of the composite resin with the tooth structure. Same way, when the it cannot be used under glass enamel cement because the leached eugenol into the dentine, it can diffuse and cause the discoloration of the glass enamel cement. So what are the advantages of this cement? It is giving you obtundent effect. It is less dimensional. It is having a less dimensional changes. It gives you good marginal seal. The modified forms of this cement is having a sufficient strength for the luting. Now, what are the disadvantages? It is having a low compressive strength, highly soluble, then mechanical bonding with the tooth structure, no chemical bonding, not anti-kerogenic. So these are all are the disadvantages of the cement. Now, the for any modification of any cement is done to improve certain disadvantageous properties. Now, here we can see now because of the eugenol, it is quite irritant. It is allergic to some patients, so it is modified in that way. And also the compressive strength of this cement is very low, so it can be increased by addition of some of the different components which can increase the strength. So, if they depending on this, there are four types of modifications that are done for the strength. There are two modifications, resin modified and ethoxybenzoic acid alumina cement, or also known as a super EBS cement. Then to replace the eugenol, there is a non-eugenol cement, and there is one more modification, that is the endodontic sealer, where certain medicaments are used. So we will just see it one by one. In resin modified, in the composition of the powder, natural or synthetic resin, or you can see polymethylacrylate, polymethyl methacrylate are added in the powder to increase the strength. And by increasing the strength, it is used as a permanent cementation material, or it can be used as a temporary or intermediate type of the restoration which lasts longer, and it can be used as a cavity lining agent. And second is the ethoxybenzoic acid alumina, or a super EBA. Now here, as the name, two names are here, ethoxybenzoic acid and the alumina. Now, as the name suggests, ethoxybenzoic acid, that means it must be added in the liquid, and the alumina is added in the powder. So the fused alumina is added in the powder, and the orthoethoxybenzoic acid is added in the liquid, and it is mixed, and it gives you increase in the strength. The uses are same as we have seen in the resin modified, that is permanent cementation, or IRM material, or that is intermediate restorative material, and cavity liner and the base. The third type is non-eugenol cement, that is especially for the patient who are allergic, and as we have seen that it is contraindicated with the composite resin. So where you will be using a resinous type of the restoration. So if you want to use a eugenol cement, then you will zinc oxide eugenol cement, then you will have to do the modification in the liquid. So instead of eugenol, carboxylic acid is added, and then it can be used to do the resinous type of the restoration, and to that means to lute the temporary crown when resin cement is used, and for the patient who are allergic to the eugenol. Now the fourth and the last modification is the endodontic sealer. I hope you are knowing about what are sealers. Now, just to give a brief idea about what we mean by sealer. Sealer means what? When we do the root canal treatment, so we remove all the pulp tissues from the root canal. Okay, and after emptying and after cleaning the root canal, we do the root canal filling. Now, the root canal filling material is the most commonly used gatta. Okay. Now, when we insert the gatta points into the root canal, in between the two gatta points, there may be the spaces are remained in between the two gatta. So to remove that space, whenever we do the root canal filling, we coat the gatta with the zinc oxide eugenol cement, and then we insert it into the pulp cavity. So it removes the gaps in between the two gatta points. So the zinc oxide eugenol cement is the most commonly used sealer in the root canal filling. Okay. So here in endodontic sealer, in zinc oxide eugenol, certain medicaments like paraformaldehyde or corticosteroids are added, which improves the antibacterial property of this cement. So it is giving you good results of your root canal filling. So this is the modification by adding certain medicament while using it for the root canal or endodontic sealer material. So these modifications are very important. They are most commonly asked in the examination. Then coming to the summary and conclusion of this cement, it is an acid-base reaction type of the cement which is mechanically adhering to the tooth. It is a non-tooth colored cement with a low compressive strength and a high solubility. So the applied aspect of this cement is, as this cement is having a low compressive strength and high solubility, it is used for only temporary restoration, no permanent restorative material, and low strength basis. Because of its obtundant property, it is suitable for use to relieve the post-operative pain, sensitivity, and pulp protection. And here I want to add one thing, that many of the books mention that zinc oxide eugenol is used as a pulp capping material, but in that may be present in the older edition, but because of the new materials are there in the market, and it is observed that zinc oxide eugenol doesn't produce reparative dentin formation, so it cannot be used as a pulp capping agent, because the pulp capping agent is the calcium hydroxide, which induces the reparative dentin formation. So please don't go that zinc oxide eugenol is a pulp capping material. It is just to give a obtundant effect to the pulp. So these are the references from where I've taken certain points to complete this presentation of the zinc oxide cement. So the expected questions are, long answer questions are very rarely asked, but you should know the composition, role of ingredient, setting reaction, and the factors affecting the setting of zinc oxide cement. The most commonly the short answer questions are asked on this topic, that is properties of ZNOE cement, advantages and disadvantages of ZNOE cement, types of ZNOE cement, and the modified forms of Illinois cement. One more thing that I wanted to add here, that many a times when we check the papers, while writing the indication or the uses of zinc oxide eugenol cement, many of the students they write or they get confused with the zinc oxide eugenol impression paste, and they write it is used as a final impression to make the final impression. So please don't get confused with the zinc oxide eugenol impression paste and zinc oxide eugenol cement. Zinc oxide eugenol impression paste is an impression material, and zinc oxide eugenol cement is a restorative type of the material. It is a type of a dental cement used for only liner, base, or a temporary luting material or a temporary restorative material. So please don't confuse with cement and impression paste. This is all about from my side for zinc oxide eugenol cement. Thank you so much.